Hey guys, what is up? Welcome back to my channel. Today is another nursing series video and I'm gonna be sharing with you guys my nursing patient report sheet. This is very important for your day. Can't see anything. Why? Because I don't have my glasses. Why? Because I want my makeup to look good. But I also don't want to put contacts in because I have dailies and I would just take them out after this video, you know, and that's just a waste. So we're just gonna not be able to see. So if I'm not in focus or I'm like staring off into space somewhere, or I'm like squinting, then you know why. I gotta start saving for LASIK eye surgery. I don't like wearing glasses, you know, and at work it sucks and I'm wearing my face shield and everything gets foggy and then it's like they're always in the way, you know. And then if you want to do your makeup nice and you really can't see your makeup because you got goggles on your face, and then, you know, I don't like contacts. I don't like touching my eyeball. My eyes get dry throughout the day and they just kind of get tired, and I don't like it. I don't like it at all. So let me know if you've gotten LASIK eye surgery before and your experience with it, because everyone says it's like the best investment. I remember like the week before I started my nursing job, even clinicals, I went on Google and started looking at patient report sheets because, you know, all of the nurses had these on their little binders, and I remember finding ones on Google and they were so overwhelming and just so much information crammed on a little sheet. And I did print one off, and that's what I actually took to my job the first day. And then over the past year I have just made this up. So I'm going to see if I can get this right in focus for you guys so that you can pause the screen if you want and copy anything down. Hopefully you can see that, and I'll go through it column by column what I write. Now, I can't take complete credit for this. This is actually a modified version of the one that my preceptor on first shift actually uses and made up herself. Like I said before, the one that I came in to work with my first day was just super overwhelming and there was so much information on it. And finally I just asked my preceptor, what do you write on yours? What kind of, you know, system do you have for writing things down? And she showed me hers. So that's kind of the basis of having these columns. Some of the things have stayed the same, and then over the past year I've just modified things, but I cannot take full credit for this exact sheet, but I have made it my own. So let's get right into it. So in this top part of the piece of paper, I'm gonna put my patient's first and last name, whatever room number they're in, what their age is, what their code status is, if they are full code, select DNR, full DNR, and then right up here in the middle, I will put the date they were admitted and why they were admitted. In the other top section of my piece of paper, I have a pre-made checklist. So I have one original of this and then I make copies of them. But all of this is what I need to chart on when I discharge someone, and then this is just what I need to chart on for every patient for every shift, and then at 3 o'clock I just need to chart on a few different things as just an update. So let's get right into the different columns and what I put there. So this first one, which I have labeled to do test and history. So I will put the patient's health history right on top here, and then underneath that I will put any results from x-rays, chest x-rays, MRI, CTs, UAs, anything like that. And then somewhere in the bottom is usually where I will put what their plan of the day is. Is the plan to do pain control and then advance their diet and then they can go home? Is their plan that they're ready to go home today? They just can be picked up first at 4:30 p.m. after their spouse gets out of work. Whatever the plan may be, I will put that down below. Then the next column is labeled labs. So there are certain lab values that I'll mark down in this section. Typically it's just going to be stuff that's abnormal. And then I will also do our potassium and magnesium protocol. So at my hospital, I will supplement anyone that is on the protocol, and if their magnesium is less than 2.0. And then for potassium, if they're on the potassium protocol, I will supplement any level below 4.0. So whatever it may be, I'll throw that in there, and then I'll even throw it in there and then just write not on protocol, just so I know I can pass it along to the next shift. And then if their white blood cell count is high, if their hemoglobin is low, I'll put that all here. Now there are certain lab values that I will just put in this column regardless if it's within defined limits or if it's abnormal. Some of these might be D-dimers, troponins, procalcitonin, things that the doctor kind of ordered aside from the basic labs, or like a lactic level, especially if things are trending lab values like troponins. If they do a set of 3, I want to know what all 3 are. Were all 3 negative? Was the first one positive and the second 2 are negative? I like to see the transition of lab values. The next section is medications, and then on the bottom I have a section for PRN medications. So on the left side I will write down the time, so I will write 0900, noon, 2 o'clock, so on and so forth, and then I'll write a little line and then I'll put the med over here. I personally write down every med that the patient has to get throughout that day. Some people just write down the times that you have to give meds, and then they go and look at what they're supposed to give. I have the time and the med name down. In the bottom PRN section, I write both what medications are they able to have, how much, how often, when was their last dose, and then I also write what I gave and the last time. Typically, if it's a pain med, I'll try to at least have down the last dose I gave before shift change, just because if a patient can get morphine, let's say every 2 hours, and I give it at 6 p.m., I'm gonna try to remember to write that I gave it at 6 p.m. so that when I give report at 7, I can say I just gave it to them an hour ago. You're not able to give that to them until 8 o'clock tonight. Just so they kind of know, it's just better communication skills. And then in this next section, I have if they're diabetic, diet, vitals. So right away on the top, I'm gonna put what diet are they on. Are they a diabetic, therefore on consistent carb moderate diet? Are they a regular diet? Do they have fluid restriction? Any of that I'll put right here. Then next under that, I'll put if they're diabetic or not, how often are we checking their blood sugars, what were their blood sugars. I'll just write, 3 lines, it'll do the breakfast, lunch, dinner one. I'll also put down in this column if anything that's kind of abnormal with their vital signs, if their temperature was high. And then below vital signs, right at the bottom of that column is where I'll put any kind of output from drains. So if my patient has a JP drain after surgery, I'll mark down the output from the previous shift and then what the output was for my shift. In addition, if they have an NG tube, what was the output. Then this last column is home, activity, consults. So I will put on the top where they come from. So are they from an assisted living facility? If so, what's the name of it? Are they from home with their spouse? Do they live at home alone? And then I'll put down how they walk. So are they a standby assist with a walker? Are they up with a walker and a gait belt? Are they independent in the room? I definitely want to know that information. And then on the bottom part, I'll kind of talk about if what the plan is of where they're going to go, and then also their consult. So GI is on consult, general surgery, infectious disease, ortho, PT, OT. I'll write down all of that in this bottom area so I know what people are going to be seeing that patient. Lastly, in this bottom column, I just have a full assessment written down. I just have if they're alert and oriented, pain, if their extremities are edematous or not, what their heart sounds are like, lung sounds, are they on oxygen, room air, what their belly is like, if they're peeing, pooping fine, if they have any skin issues. And then in the top column, I just have IV. So where their IV is, do they have a central line, just a peripheral IV, and then what they have running at what, or are they capped? So lastly, something that I wanted to talk about with report sheets is if you work day shift, you might have to go to some kind of meeting in the morning that kind of talks about each patient, what their plan of care is. We call ours OFTs. They're at 10 o'clock. Everyone's there. Right now we just talk on the phone to everyone, but The nurse goes through patient by patient and kind of gives them a little backstory of why they're here, where they're from, where they're going, what their plan is, what's their barriers to discharge, are they ready to go. It's kind of just a way to make sure that all of us healthcare workers and team members are just on the same page. So really quickly, I'm just going to talk about what sections of this I highlight. I like to highlight the things that I'm going to say in this meeting before I go in. Otherwise, it gets really easy to babble on and on about a patient. And honestly, there's things that they don't want to know about. They don't really care if they're on a regular diet or not. I mean, it's just, there's some simple things that it's like, you're explaining too much. So I will highlight their name, obviously, and their room number. And then I will highlight why they came in, what date they came in, and what brought them into the hospital, and if anything has changed. So, for example, I might have that a patient came in on July 5th and they have pneumonia, they're positive for COVID, let's say, and now they're inpatient hospice. So if their plan of care or their diagnosis has changed majorly since being there, I'll kind of make a little short flow and explain that. Moving on from explaining why they are here, I will go to where they came from. So home alone, with a spouse, assisted living, nursing home, yada yada yada. After that, I will explain who is on consult for this patient. Is there anyone that I feel needs to be added? Does therapy need to work with them or see them before they are discharged? Anything like that. Then I will jump way over to their plan of care. What are we doing for them? What are their barriers to discharge? Do they plan on leaving today, tomorrow, over the weekend? Kind of length of stay information. That's it. That's all I'm going to talk about in OFTs. Really just get the pertinent information down. If you don't mark down what you feel is important to say before going into something like that, I feel it's very easy to talk on and on and on about a patient, especially when you have 5 of them. So that's it for what's on my report sheet. I feel mine is pretty easy to follow, simple, not super overwhelming, easy peasy lemon squeezy. With whatever report sheet that you decide to do, I mean, everyone is different. I made my layout and then I just make copies in the copy machine. I make like 30 at a time and then I just keep them in my binder and grab one out. Some people just grab a piece of printer paper every day and they fold it in 4s, and then they just have certain things that they write in certain corners, or they use a different color pen for certain things. Everyone's different. This has just worked really well for me over the past year, so I thought I would share it for you guys. I know it was something that I was looking for when I started clinicals, when I started my job, and all I could find online was super elaborate, very overwhelming examples. That's all that I have for this video. I hope you guys enjoyed it, and I hope this can give you a good guideline to make a report sheet that works for you. Heck, if this is the one for you, take it. Because all I have to say is an organized workflow makes for a great workday. That goes for life too. I mean, an organized life makes for one good life. That's all I gotta say. Thank you guys so much for watching, and I will see you in my next video. Bye!